This introduction to unknown primary cancer was created by Beyond 5 for the benefit of patients and families affected by unknown primary cancer. Unknown primary cancer means that a cancer has appeared somewhere, usually in a lymph node in the neck, but we don't know where it started. Primary refers to the part of the body or organ where the cancer originated. The term secondary or metastases refer to areas where the cancer has spread. For unknown primary cancers in the head and neck, the most common sign is a lump in the upper neck, just below or behind the angle of the jaw. This lump is a cancerous growth within a lymph node. Lymph nodes are small bean-shaped glands in the neck that are part of the immune system's defense against infection. Most cancers that appear in lymph nodes are not primary cancers. A healthy lymph node is normally about 1 centimeter wide or less. Lymph nodes often swell and become sore in response to an infection, such as a cold. This is normal and usually only lasts a few weeks. If you have symptoms for more than a few weeks, talk to your doctor so that problems can be diagnosed and treated as early as possible. If a lump in the neck persists for more than a month, it may be due to cancer, especially if the patient is over 40 and if the lump is painless. For unknown primary cancers, the first step is to find the primary. A biopsy of the lymph node can often help with this process. In the head and neck, the most common places where primary cancers can hide are the tonsils or the tongue base. Other primary sites include the skin, mouth, nose, sinus, throat, voice box, thyroid, and saliva glands. Occasionally, the primary cancer may be in the lungs or organs in the abdomen. In about 10% of patients, the primary cancer will never be found. This is okay because the chances of cure is the same whether it is found or not. Often because the process of treating the cancer in the lymph node will also treat the primary cancer hiding in the body. For further information, please visit www.beyond5.org.au.